and welcome to the Case Manager Show. This is Shirley Tabb, your host and social worker. I am so glad to have my guest today, Miss Camilla Pickett, who is the Outreach Director for the Health Insurance Counseling Project at the George Washington Legal Clinics here in the District of Columbia. And we've invited Camilla to come on the show today and talk with people about this wonderful program, the Medicare Savings Program, and how it works. This is a program that allows people who have Medicare but don't have a lot of income, but have more income than would qualify them for some other government services to get some services and save some money. And that's what I'm really excited about. So Camilla, why don't you tell us what the Medicare Savings Program is?
Sure. Well, thank you very much for the invitation and the opportunity to do this.
Certainly.
To give information to DC's Medicare beneficiaries. Like Shirley mentioned, I am from the Health Insurance Counseling Project at GW. We are the SHIP for the District of Columbia. That's the State Health Insurance Program. Okay. And we are basically charged with being the decoders of the Medicare information for DC residents, meaning we do all of the Medicare counseling and outreach to make sure that you are able to access your Medicare benefits in a way that's most beneficial to you. Okay. So thank you very much for having me.
No problem.
The Medicare Savings Program basically is exactly what you said. It is a program designed to help Medicare beneficiaries with limited income to save money. Each state has its own version of the Medicare Savings Program, and they're a little bit different. In the District of Columbia, it's also known as the Qualified Medicare Beneficiary Program, the QMB. And what it does is it pays for Medicare premiums, most notably the Medicare Part B premium. It also pays for co-payments and deductibles. And most significantly is it helps pay for Part D prescription drug plans and prescription medications at a discounted cost. So it's tons of savings all around.
Well, that's wonderful because I know in the work that I do, assessing district residents for Medicaid waiver, once they are approved for Medicaid waiver, they automatically become qualified Medicare beneficiaries.
Right.
And which is awesome because then that $96.40 that Social Security deducts from your Social Security income every month no longer gets deducted, and the district government pays that.
The DC pays for that, and it's not always $96.40 for some people. The premium for Part B was $96.40 for people who were having Medicare premiums taken out of their Social Security prior to 2009.
Okay.
There hadn't been an increase in that premium because there was not a cost of living increase associated with Social Security. But for new Medicare beneficiaries for 2011, the premium per month is $115.40.
Oh, so wow.
It's a bit more.
It is.
But in any case, this program helps to pay for that premium.
That is really, really, really great news. So people out there might be wondering, is this a new form of insurance? And if so, how much does it cost? Or if it's not a new form of insurance, then what's it going to cost me? Because nothing's free.
Nothing is free. People always say that. This is actually not a new insurance. It's not insurance at all. It is exactly what it says it is. It's a savings program. So it's designed to help people who have Medicare pay for costs associated with having it. So it's not different insurance. There's no premium attached to it. All you have to do really is fill out the application. And I know when things sound too good to be true that they usually are. This is a case where it isn't. It's designed to help keep more money in your pocket. So it's not a Medigap program. It's not like an AARP program. It's not insurance. It is help paying for what it is that you already have.
Okay. Okay, so would I have to find a new doctor or be treated at a certain hospital?
No, you don't. You can actually remain with your doctor as long as your doctor accepts Medicare assignment. So if you've been seeing a doctor and your doctor has been accepting that trusty red, white, and blue Medicare card, then you can continue to see that same doctor or that same provider. You can go to the same facility. You don't have to switch anything about your care. And actually, it's important that you don't, because we'd like for you to have continuity in your care. This just helps pay for the care that you already have.
Okay, now let me ask you this.
Sure.
I know that with Medicaid waiver, in order to qualify for Medicaid waiver, a case manager, social worker, such as myself from a home health agency must go out and do an assessment to determine whether people are qualified. And this is a process, and you can't get into the Medicaid waiver program without this process.
Right.
What is the process for
filling out this?
For this? Yes.
Paperwork. That's it. There are 3 qualifications for the program first. So I'm going to explain that first, and then I'll talk about the actual process of applying. So the first qualification is that you be eligible for Medicare, which sounds simple enough, but it's a difference between being eligible for Medicare and being enrolled in Medicare. Okay. Being eligible for Medicare in most cases simply means that you have reached the age of 65 or above. There are people who are eligible for Medicare under the age of 65 because they have some sort of disability, and they've been receiving Social Security disability benefits for a period of at least 24 months. So those are the main ways that someone is eligible for Medicare. You don't have to be enrolled, you just have to be eligible. The second requirement for this program is that you be a bona fide DC resident. Now, we have tons of people that socialize in DC. They stay overnight in DC, but they don't actually have a DC residence. So for this program, you need to be a bona fide DC resident. And the third requirement is an income guideline. For a single person, the income per month needs to be less than $2,743. If you are part of a couple, then your income per month needs to be less than $3,698. And that's it.
So let me ask you this. If my husband and I both apply for the Medicare Savings Program.
Yes.
And our income is the $3,698.
Right.
So we both can qualify.
Absolutely.
For.
Absolutely. You can apply as a couple. You can fill out the application, and you just actually would need one to fill that out, because you put the information for yourself and for your spouse.
Okay.
Along with the joint income information. So it's really as simple as that. There is no asset test. A lot of states have kept that, meaning that they look at the income that you get per month,
right,
as well as anything you may have in savings or any property that you own.
Like Medicaid waiver.
The DC City Council actually eliminated the asset test in 2008, I believe. So that's no longer a concern.
Oh, that's great.
Mainly because you shouldn't have to choose between, rent or food and healthcare.
Exactly.
That shouldn't be the choices that people have to make. And so it really only looks at the income that you rely on per month, not anything you have in savings or not any property that you may own.
And that is wonderful news to me, because I've been talking to people about the asset requirements for Medicaid waiver. And I'm hoping that with the assistance of the National Association of Social Workers Metro chapter and those of you out there in the community, that we can start a dialogue with district government about doing away with the asset requirements for Medicaid waiver, because right now people are being penalized because they've saved up a little money, or if they've saved money to put the roof on their home, or a lot of seniors, they save their money for their final expenses. Right. And we are going in telling people, if you have more than $4,000 in the bank, if you are single, you don't qualify for this program. I think that's unfair.
It definitely is not the most optimal position
Yes.
to be in, is what I will say very judiciously. But I will note that there is a difference between Medicaid and the QMB program. So it is possible for Medicare beneficiaries to have full Medicare benefits as well as full Medicaid.
Yes.
And if that is the case, then they would already be reaping the benefits that the Medicare Savings Program has to offer. But a person can be eligible for the Medicare Savings Program without being eligible for full Medicaid benefits. And I think that's where a lot of people get confused, and they think, well, I've never been eligible for Medicaid.
Right.
So I probably won't be eligible for this. And that is not the case.
That is not the case.
The three qualifications that I gave are, in fact, the only qualifications for this particular program.
Now, I recall someone saying that if you are under 65 and you are undergoing dialysis,
yes,
that would automatically qualify you for Medicare. Yes, is that true?
That is one of the conditions. People that have end-stage renal disease,
yes,
are usually eligible for Medicare. There is, however, a list. There's qualifications associated with being in a renal failure,
right,
with being on the list for a kidney transplant.
Yes.
And those are determinations that Medicare makes. So
okay,
we don't make those determinations.
Okay.
That's something that happens a little bit above
yes,
our heads.
Yeah.
But what we can do is once you have been deemed eligible for Medicare, we help you after that.
Okay. Okay. So then, if I am applying, you mentioned the medications that I'm taking.
Yes.
Do I include a list of the medications?
No, you don't have to do that. Actually, that's a perfect segue for me to talk about the application process. So the application itself is about 4 pages long. And the information that it asks for is fairly simple. It asks for your basic demographic information, where you live, and it asks for your income. Along with that, you need a copy of your red, white, and blue Medicare card, a copy of any other insurance card you have, whether it's Blue Cross or Aetna. You need a copy of that. You also need proof of DC residency. It can be a license. It can be a copy of a utility bill or an ID card, something with your name and a DC address. And you also need a proof of income. For most people, that will be a Social Security statement.
Okay.
And so that's easy, fairly simple to get. Social Security mails those out at December, and that statement tells you what you're going to get per month for the next year.
Right.
You can use a copy of that letter along to prove the amount of income that you have. And you send all of that in with your application, and that entitles you to the program once you've been approved. That's all you need in order to apply.
Okay. Camilla, why don't you give your telephone number, your contact information, and I can say to you all that I have worked with Camilla and Chris over at the Health Insurance Counseling Project, and they are wonderful, and they receive your calls so graciously, and they are very knowledgeable, so call them. Don't call me because they know a lot more about it than I do, so give them your number.
That is what we're here for. Our number is 202-739-0668. I think they're going to put it up on the screen. As Shirley said, I work with some fabulously talented and knowledgeable people who are here to answer your concerns and questions. So even if you're not sure if your question falls within the realm of what we do, give us a call. If it's not our agency that handles it, then we can surely direct you to someone who does. But if you have questions about this, and I know that it's a lot of information and it gets confusing, then feel free to call. We take all types of questions. We don't shy away from them, because the most important thing is to make sure that you're getting the information that you need in a way that you understand, so that you can get benefits that are available to you.
Sure. And you all also go out and speak to churches and organizations and different groups.
And actually, we can talk about that in the next segment.
In the next segment. Very good. Well, we are going to take a quick break, and we will be right back, so stay tuned.